So now that we've covered all the structures on the coronal section, let's take a look at it on a horizontal section. But first, let's distinguish how we can tell the difference between a coronal section and a horizontal section. Because guaranteed, you're not going to have an indicator like this telling you which way the brain is sectioned. So what I like to look for is the longitudinal fissure. So on a coronal section, we're going to have this longitudinal fissure separating our left and right hemispheres. And we also have this corpus callosum right here, that bundle of white matter, as it's going to connect those two hemispheres. Another structure that you'll see in the coronal section that you won't see in the horizontal section is this area right here. So these structures, the amygdaloid nucleus and the hippocampus, are going to be found within that temporal lobe. And when we're looking at a horizontal section, it's cut through the brain like this. So you're not going to get that inferior portion where you'll see the temporal lobe with these structures in it. So let's take a look at that now. So you can see here, we have a horizontal section. We're dividing the brain into superior and inferior. And this view right here is going to be a superior view looking down. And you can already see it looks a whole lot different than the coronal section. Here's that medial longitudinal fissure right here, but now we have structures kind of getting in the way of that. So we have our left and our right hemispheres, but we no longer see the temporal lobes and those amygdaloid nucleus and the hippocampus. So now with all that said, let's get into identifying some of our basal nuclei. So we'll start off where we start off with the coronal section by labeling our caudate nucleus. For some reason, I always love to identify this first. It just makes things a little bit easier for myself. So the caudate nucleus is going to be found right here. This would be the head of the caudate nucleus, and it's found making up the lateral wall of that lateral ventricle. And remember, we talked about how the caudate nucleus will form that C shape and come around. So if the head is sectioned here, our body of the caudate nucleus is going to be sectioned back here. And you can see it's kind of making up the wall of the lateral ventricle here, but it's actually making up the floor of the lateral ventricle. So let's just throw some labels in there. And then we'll go on and identify the most lateral structure of the corpus striatum. And if you remember it, it's this blue structure right here, found most laterally. This is going to be the putamen right here. Found medial to the putamen, again, we have that globus pallidus externus, and then found medially to the globus pallidus externus, we have that globus pallidus internus. And then again, if we have our lateral ventricles right here, towards the midline, we're going to have our third ventricle right in here. And what do we know that makes up the lateral walls of our third ventricle? Well, that's going to be our thalamus, or our thalami. So our two thalami on either side of the lateral ventricle. So now we'll take a look at that white matter bundle, those projection fibers that we found between the caudate nucleus, the lentiform nucleus, and the thalamus. So this white matter bundle right here, if you remember what this is called, you know that it is the internal capsule. And you'll notice that the internal capsule has this very distinctive V shape when we're viewing it horizontally compared to when we're viewing it coronally. So now we'll move just outside the corpus striatum and identify those two other white matter bundles and that sheet of gray matter. So we talked about this being the external capsule. If this is the internal capsule, we have that external capsule just outside of the putamen, and we have the claustrum right here, that thin sheet of gray matter. And then we have that extreme capsule between the claustrum and the insular cortex because it's extremely out there. And then finally, we're going to return to the midline and identify those two little circular type structures right here. These are those white matter bundles known as the fornix. And you can see from a horizontal section, they actually look a lot different because they follow that distinct pattern which we talked about, how they come anteriorly and then they're going to travel posteriorly and then come down into that temporal lobe. So you can see the fornix is like the caudate nucleus in the sense that it has that C-shaped appearance. So it's going to be caught in two different sections of our horizontal section. So it's going to be found right here as well as right here, just like the caudate nucleus was found right here and right here. So let's go in and label those. Awesome. So now that we can identify everything on a coronal section as well as a horizontal section, I'm going to show you guys a brain scan and you guys tell me what section this is taken from. So if we look at it, it's quite long in its shape. We would find first our medial longitudinal fissure. It's found anteriorly and it's found posteriorly, but here we have all these structures blocking it off. So what does that indicate that this is? That indicates that it's a horizontal section. And the more brain slices you view, the more comfortable you will be and just be able to automatically identify what you're looking at. So now that we've identified what kind of section it is, let's go in and label those structures, which we talked about in the previous slides. I'm going to zoom in a little bit to make things a little bit easier on us. You can see we have this large structure right here, and it's protruding into our lateral ventricle. So our ventricles are filled with cerebral spinal fluid, and on this type of MRI, they appear hyper intense. So they appear very bright. And this allows us to indicate where all the boundaries of our ventricles are. So protruding into the lateral wall of the lateral ventricle, remember what structure we had? We had that caudate nucleus. So you can see that caudate nucleus down there. And then we also have this large structure right here, which is going to be the most lateral aspect of our corpus striatum. If we remember what this is going to be our putamen. And then found just medial to the putamen, we have the globus pallidus internus and externus. Now they're a little bit difficult to see on this image, but if you know your neuroanatomy well enough, you'll be able to predict exactly where they are. And of course, just lateral to our third ventricle, which we can see right here, we have these two big guys right here. So these are going to be our thalami, or our thalamic bodies. So let's go in and color those. And remember, we had a thin sheet of gray matter just outside the putamen. So that's going to be our claustrum. It's going to be a little difficult to see just because of how thin it is, but we can see a faint little outline right around here. And just outside of our claustrum, we would have that extreme capsule. Inside or medial to our claustrum, we would have that external capsule. And we'd find our internal capsule right here between our thalamus, lentiform nucleus, and caudate nucleus. And we have one more structure I think we can identify on here, and those are going to be those fornices. So those two white matter bundles found right at the midline. And it looks like they're coming right around here. So these are going to be those fornices as they pass from anterior to posterior. And actually, on that note, we can also see the body of the caudate nucleus found right here, just along that lateral wall or floor of our lateral ventricle. So those are all the structures of the basal ganglia. I hope you found that video useful. And if you have any questions, always feel free to reach out to us. That's going to do it for this video, and I'll see you guys in the next one. Take care.